Good afternoon, everybody, and welcome to this fourth in a series of 6 webinars of the Pan American Health Organization Sustainable and Development and Environment Office. My name is John Balbus, and I'm the Senior Advisor for Public Health at the National Institute of Environmental Health Sciences, and also co-chair of the Institute of Medicine Global Environmental Health and Sustainable Development Innovation Collaborative, which is the group that's helping to put these webinars on. So on behalf of the Innovation Collaborative, I'd like to welcome everybody. This is the first of 3 webinars that we'll be having this spring and summer. And if you look on your screen, you'll see the dates of the webinars for the rest of our series, numbers 5 and 6. And we look forward to having you all involved, participating in the discussions as we look at different aspects of health in the context of sustainable development. Our topic for today is going to be health in the context of sustainable economic frameworks. We all know that the gross domestic product, or GDP, is the most commonly used indicator of economic health of a country. It's also used to gauge a country's standard of living. But of late, there's been a lot of interest in other indicators to measure standard of living, especially alternatives that can incorporate externalities, as we call them in economics, externalities like environmental impacts that can affect the sustainability of economic growth, and also indicators that can capture aspects of human well-being other than the amount of consumption, which is the basis of the gross domestic product. As people in the public health and the global health field know, economic gain and public health are closely intertwined. Health is both a beneficiary of economic development, but also a prerequisite for sustainable economic development. And so as we talk about indicators, as we talk about health in the context of sustainable development, it's very natural that we start today with a discussion of indicators and metrics of economic growth that can address not just the level of consumption, level of production, but also these other externalities and other aspects of sustainable development that reflect all of the pillars of sustainable development. This webinar is being held under the coordination of the Institute of Medicine's Roundtable on Environmental Health Sciences, Research, and Medicine. And we acknowledge the funding of my institute, the National Institute of Environmental Health Sciences, and the support of the Pan American Health Organization in making today's event possible. So without any further ado, we'll move on and start today's webinar with a presentation from Dr. Kevin Mumford. Dr. Mumford is an assistant professor in the economics department at Purdue University, where he has been since 2007. He has a doctoral degree in economics from Stanford University and a bachelor's degree in economics from Brigham Young University in Utah. Professor Mumford has received research grants from the Institute for Research on Poverty, from the Upjohn Institute for Employment Research, and the Alfred P. Sloan Foundation. And in 2010, he was awarded the John and Mary Willis Young Faculty Scholar Award for Research Excellence. So Dr. Mumford, we're very happy to hear from you, and you can start now.
Thank you very much. My presentation today is an introduction to using GDP to measure economic development, some of the difficulties with that, when it's not sufficient, and what has been done to try to address those challenges. Also to talk a little bit about wealth accounting. So on this first slide where I talk about the national income accounting, the idea here is that countries are collecting large amounts of data to produce GDP statistics. It's quite narrow in that it's focused entirely on income accounting. And so the kind of data that we would like to see is not always produced because there has not been a large demand for that data, and also sometimes the data is difficult to collect. Income accounting is not sufficient for answering many important economic questions, and that's because well-being is not equivalent to GDP. Growth in GDP does not necessarily indicate growth in well-being, and it does not necessarily indicate that an economy is on a sustainable path. And so I have just one example I wanted to give. Recently I was at a meeting and I met a representative from the country of Trinidad and Tobago. So these are two small islands that are just off the coast of South America. They're in the Caribbean, and they're fairly small. There's 1.2 million people in this country. But until just recently, and over the past 25 years, this country has experienced very high rates of GDP growth, 8% annual GDP growth. Not only that, but there's a high level of international business activity and a very stable financial system. So, one of the things that this representative told me was that in 2011, the OECD had just moved this country from developing status, from developing country into the developed country list. And so, sort of that they have arrived. And I have a picture here to show you, just a small graph. So the blue line here represents the GDP per capita for this country, Trinidad and Tobago. And then in yellow there is the graph for the world. This is average or per capita GDP. So you can see how rapid this country's climb in GDP has been. And by all indication, then people might think to themselves, this is a country that is clearly growing rapidly and is developing. But these GDP numbers may be misleading. The reason they may be misleading is because most of this GDP growth is due to the extraction of natural resources. So as an example, they have 0.2% of the world's natural gas reserves, which doesn't seem like very much, but of course this is a small island, so that's a significant amount of natural gas. But on the other hand, they produce 1.3% of the world's current natural gas. And so they're extracting at a rapid rate, and that's true not only of natural gas, but also of oil and other minerals. So with half of their GDP coming just from the extraction of minerals, what this represents is a drawdown of the country's resources. They're extracting their wealth out of the country. And just some other statistics about this is that apparently the average worker spends about 4 hours per day commuting, indicating heavy traffic. Also, the expected years of schooling is 11.9. This is a measure of if everything were to remain at current rates, the current young population, how many years of schooling would they be expected to achieve on average? 11.9 years, and this is compared to an average that is higher in Latin American and Caribbean countries. And even though the average GDP in this comparison group is lower than the average than the per capita GDP in this country. And so, some other indications tell us maybe things are not quite so good in this country, even though GDP growth has been very rapid. Okay, so it looks as though this next slide, I can't see it. I may just have to oh, no, it's, okay. It's appeared for me now. Maybe it's appeared for you as well. So in the next slide, the question is income growth sustainable? And extracting resources from an economist's point of view is not necessarily a bad thing. It doesn't necessarily mean that this country is making mistakes. So extracting mineral or energy resources could be a good decision, but it depends on what the income from these extracted resources is being used for. So when we invest in equipment and machinery and buildings and roads and ports and any of these types of things, this investment yields future income. That from the economist's point of view would be considered something that potentially is sustainable, to extract this natural resource and then use it to build the productive base. That could be sustainable. Using that income immediately for pure consumption, that doesn't yield future income, and so that's not likely to be a sustainable path. And just to point out, investment isn't just limited to these types of natural resources. Investment could include, allowing a forest to grow. It could include leaving a fishery alone and allowing it to restock. Those types of things would also be considered investment. Okay, so the reason from my point of view the GDP isn't sufficient is the GDP is just a measure of income, and income doesn't tell us what we're doing to our wealth. There's been various proposals, for example, doing adjustments to GDP. I've seen green GDP or sustainable GDP measures like this. I've also seen various social indicators, so reporting simply life expectancy or poverty rates or unemployment, education levels, and then sometimes these things all combined into various indices like the HDI. There's also environmental indicators. So these are measures of water, air pollution, climate change measures, sometimes directly measuring things like fish stocks or forests. And then also there's a set of research looking at direct measures of happiness, usually surveys trying to ask people about their well-being. And of these, the thing that I'm most excited about is national wealth accounting. Now, I can't see this slide yet either, but I'll hope that it appears.
There may be a lag on yours, but we are seeing it here in Washington.
Okay, wonderful. Okay, so well, I'll just continue on then. So national wealth accounting, what I like best about this is that it's a theoretically rigorous approach. That rather than making some sort of an ad hoc adjustment to GDP or combining a set of social indicators with arbitrarily chosen weights, wealth accounting is a wonderful complement to income accounting. And we've got a whole set of literature describing why this is such a why this approach, wealth accounting rather than income accounting, why this makes sense. So, for example, there's this theorem by Dasgupta in 2001 showing that potential intergenerational well-being is closely related to a measure of comprehensive wealth. So, nowhere in measuring wealth do we need to make any assumptions about optimality, and you don't necessarily need to make any assumptions about the country's future choices, any forecasts. One would at times need to make forecasts in order to uncover expected prices, but nothing is ever done to say that a country will continue on a certain path. So this direct measure of the productive base is called comprehensive wealth. This is in a paper that I wrote along with my co-authors Ken Arrow and Larry Goulder, Partha Dasgupta, and Kirsten Olson. It's also called inclusive wealth. This is in the Inclusive Wealth Report, and I authored a chapter in that report, and I think you'll hear more about that later. But the point here is that what we do is you simply take forms of capital indicated in this equation by KIT and multiply them by their, what economists call their shadow price, that is their value, and sum them all up, and that's the country's total wealth. And comprehensive or inclusive is meant to say that this is more than just financial assets. This is more than just equipment and machinery, but this includes things like forests and fisheries and even human capital, which is in fact the thing I'm most interested in, being a labor economist. And the nice thing is that sustainability is a simple concept here, because sustainability simply means that the wealth of a country is not declining. That is, as whatever decisions that country is making, the increases in wealth mean that they have as many opportunities in the future as they have today. Okay, so one last example, and that's just an example of a firm. Suppose that you're making an investment decision. Maybe you work for a firm that is evaluating whether or not to invest heavily in some other company, and you're supposed to evaluate the health of that company. So, suppose that you only had access to the income statement and that you did not have access to the balance sheet. So you're not able to see the value of the assets and liabilities. You're only able to see the income, the revenues and the expenses. So, how if you're supposed to do this, how could you ever distinguish a company that is, growing, has increasing income and is healthy from a company that has increasing income but yet is gaining that increasing income by simply selling off its capital stock, selling off all of its assets. Without seeing the balance sheet, you really couldn't. And to me, it seems like this is what we've been doing when trying to measure sustainability or trying to measure the health of countries. We've been so focused on these GDP measures or on sort of ad hoc adjustments to GDP measures, probably because they're easy to focus on. But we can be misled by focusing just on GDP, and really focusing on wealth is the way to uncover those differences. Okay, so my last slide is talking about some of the challenges. I can't see it either, but I'll hope that you can. So, you know, there's three major components to wealth. I would think of three major capital stocks. And the first is reproducible capital, and this is the one that we can measure the best. It's that reproducible capital is, you know, physical assets, and the current national accounts is measuring investment. And so usually what's done here is you make some sort of an assumption. You look back over 40 years of investment data, and you assume a depreciation rate, and then you back out what the stock of reproducible capital is. And directly measuring this, if this was the standard, would be better, but we do pretty well on reproducible capital. On natural capital, we also do fairly well. There's so much work measuring the stocks of forests and fisheries and minerals and energy resources and so on. There's disagreements about what the shadow prices should be, since these things are not, you know, actively traded. Certainly the value of a forest is much more than simply the value of the wood. It's all of the services that forest is providing for us. And so sometimes the shadow prices are difficult to measure, but we do pretty well there, pretty well in natural capital as well. Human capital is a different story. For human capital, you know, we have education and wage data, but ultimately we're trying to measure the productive base, the value of the skills that have been taught or that have been learned, or even the skills that have been acquired through experience, not through education. And trying to measure that is much more difficult than trying to measure reproducible capital or natural capital. And finally, even more difficult than that is health. Health is extremely tricky here because health is certainly part of the productive base. A healthier person, even with the same education and the same experience and so on, that healthier person, you know, is more productive, and you know, that's got to be included in some way. Not only are they more productive, but they simply feel better. And that's very important as well, because all of this, when I'm talking about producing the productive base, you know, I think of it as producing income, and income is then used to purchase consumption goods which produce happiness. But just feeling better directly produces happiness. And so that's certainly part of the productive base. Health makes us happier. It leads to well-being, and so that's certainly a part of our wealth. And then finally, you know, living longer. That's a part of health as well, because if you have more years of enjoying that happiness, that's part of human well-being. And on the health side, I think that we even have more challenges than on the human capital side. You know, I know even less how we're going to proceed in this direction. This is what I see as the main challenges, is that as we move into the realm of trying to value the human capital stocks, this becomes difficult. Okay, and finally, I'd just like to say thank you. I've listed my name and affiliation here, as well as 2 recent papers that you could look at that show my interest in this particular topic. And I'd also like to thank the organizer of this seminar for the chance to participate. I hope to be able to ask questions of some of the presenters as we come up, and I hope this has been a helpful introduction to wealth accounting, just an overview of why GDP is not sufficient and what we're trying to do in the future. Thank you.
Great. Thank you very much, Professor Mumford. And to everybody listening in, I just want to remind you we are going to go through each speaker and not pause in between, but you do have the opportunity to send in questions, and we will collect those questions, sort them, and ask them of the speakers after all 4 presentations have concluded. So each speaker will have 15 minutes. I'm a very draconian moderator, so if you hear some you might throat clearing, that's the first warning that the time is drawing near. And with that, let me introduce our next speaker, Professor Anantha Duryappa, and I believe Dr. Duryappa is coming to us from Malaysia, where it's about 2 in the morning, so you get special thank yous for joining us today. Professor Duryappa is the Executive Director of the International Human Dimensions Program, or IHDP, on global environmental change in Bonn, Germany. He's an experienced environmental development economist whose work largely focuses on the equity of access and the use of ecosystem services. His previous post was as Chief of the Ecosystem Services and Economics Unit of the United Nations Environmental Program. And in that role, Professor Duryappa was involved in the initiation of the Intergovernmental Platform on Biodiversity and Ecosystem Services and has since then played a pivotal role in its approval process. He initiated the Inclusive Wealth Report, which Dr. Mumford was just mentioning, and he continues to successfully incorporate his expertise in fields related to the green economy, science policy interaction, economics development, and ecosystem services into his work at the IHDP. So, Professor Duryappa, please begin.
Thank you very much. Am I coming across loud and clear?
Yes, you sound very clear. Thank you.
All right. Apparently, I'm not getting to see the slides, so looks like I might have to switch back and forth because I'm not in my usual comfort zone in the office with multiple screens. So I do apologize, but I've got to go back and forth. So you seem to be experiencing some delay with the slides. Is that right?
I think there may be some delay between what we have here and what you're able to see at your computer, yes.
Okay. Well, thank you very much. It is indeed very early in the morning, so I'm not sure how I greet everybody, but just sort of say hi, everyone, and I'm really happy to be here to make this presentation. Now, Kevin's kind of set the stage, and I'm just going to be moving along the lines that he has set up, and I'm going to talk a little bit more about the Inclusive Wealth Report, which was released in 2012. I thought I'll do it in 3 sessions based on the time that we have of 15 minutes. I'm going to have a first session just talking a little bit about the inclusive wealth. Kevin's done a little bit of that, and I'll just maybe go through that a little bit more quickly than I would have done. And in the second section, I'll talk a little bit about some of the preliminary results that we established, and then in the third section, I will just talk about some of the challenges that we're going to be facing when we are already in the process of developing and putting together the IWR 2014. We hope to produce this report every 2 years. As we're talking about stocks, the changes are a little bit more gradual than just looking at the incomes. So I guess I'm going to the next slide. I'm not sure which slide is now been shown on.
So this is the slide with 3 main points.
Yeah. I'm not sure if anybody will be seeing this, because if I'm not seeing it, I guess everybody else is not. So the 3 main points in terms of the inclusive wealth, as Karen had already mentioned, it's a new way to measure progress. So the way we've kind of taken it across is that, what exactly are we trying to measure, and what, in terms of the progress of nations. So we offer a new way. Again, the second point is it provides a more comprehensive approach to human well-being. There have been a lot of, especially now in the fact that we are kind of drawing up to 2015, the end of the Millennium Development Goals. There has been a suggestion of making a list of sustainable development goals, and you get a whole list of different sort of list of different variables, but each one very important. But in terms of how do they fit within a framework is still missing. And so the world provides that conceptual framework or the theoretical framework to the way that we look at well-being. And then, of course, the third one is really focusing on the sustainability of it, just not looking at this at a particular point in time, but really making sure in terms of looking into the future as well. So those are the three main points I would sort of highlight for the inclusive world. Now, like all economists, this framework has a lot of mathematics, but what I wanted to do is just sort of have two propositions and a definition which basically underlines the whole inclusive world. So first of all, the first proposition is well-being is defined as a discounted flow of present and future generation consumption flow. Now, I want to make a point here that this consumption flow is just not, one does not have to be limited to just the material consumptions. So issues like the utility of having an aesthetic landscape, that can be part of that consumption flow. But saying that, what the real focus here, the inclusive world does, is that it moves from the constraints of well-being, which is very difficult to monitor and define because it's so context-specific, that we look at the determinants of well-being. And so the determinants is basically then what we call the productive base, as Kevin had already alluded earlier on. And so the proposition 2 is the discounted flow of this of consumption is dependent on the capital asset or the productive base of the economy. So that's a very important proposition. And then the third, which is the definition, is that well-being increases as long as the change in the social value of that capital asset base is positive. So two key important points here, that we're really focusing on the change. So we're not looking at the absolute amounts, but just the change over from year to year. And then the next key word is the social value of capital. So here, basically, the whole idea of shadow prices is extremely important in this inclusive wealth framework. So in many ways, what I would sort of say is it's the strength of the framework. It brings in the whole theoretical aspects, the externalities, as we've been very focused on. But it's also the Achilles heel of the framework in a sense that we really need to get ideas of this shadow or social prices. And in many cases, these are not reflected in the market prices. In some cases, they are, but in the majority, they're not. And so extra work has to be done to try to get some graphs or some handle of what those social prices are. I'm kind of not using the term shadow because we just had a workshop in India on this, which was convened by the government of India, and most statisticians who were there were sort of saying that this whole notion of shadow price is very shadowy. And so there was a lot of discussion about what it meant. So in a sense, the social prices makes a lot more sense. So I'm using this interchangeably, but they mean the same thing. So what is the productive base? Well, we looked at three capital bases, the natural capital, human capital, and the produced capital. And as Kevin had already mentioned of each one, so I will not go too much into it. The ones that we find that really are going to have an impact on the wealth is natural capital and human capital. What I have in the next slide are some preliminary results of the IWR 2012, and you have you have two maps of the globe of the global landscape, and you can sort of see one is these are changes, so it's not absolute. These are just the changes over 19 years, and what we did is for 20 countries. The choice was basically based on the size of the countries, the population size, the amount of natural capital that they had. So a combination of those. But together, these 20 make up about 60% to 75% of the global GDP. So they're major producers and major drivers of a lot of the change that we see, as well as they are the home to about more than 60% of the global population. And the map below, and there are quite drastic changes between the two, is that we take the per capita. So we have taken the change in population in consideration, and you can see a lot of countries which were defined as sustainable, i.e. the change in the productive base has been positive, tend to go negative. And we basically about 25% of the countries become unsustainable based on a per capita basis. So in another way, the productive base is not growing at the same rate as to maintain that growing population in many of these countries. The only country that did better with per capita is Russia, and apparently, when we looked at the data in more detail, that their population has been actually going down. Now, the next slide shows basically two forms of capital: the produced capital and the human capital. And let's just look at the human capital, because that's the emphasis of this particular webinar. And you can sort of see how in most countries, human capital has been on the increase, in some countries much more than others. The one that I would like to point out would be Germany, which is in the developed country status as we define developed in our present terminology. And then, of course, Brazil. Brazil has been and has an extensive, rapid increase in investment in the human capital. Now, when I say human capital in this diagram, this is primarily just education. Health is not included in this, and I'll tell you why in a little while. So this is basically education. That's what we are defining here as human capital. Then the next slide, basically, we include the natural capital in terms of how the changes in natural capital, and not surprisingly, nearly every country has a major drawdown in their natural capital. And natural capital here includes both renewables and non-renewables. So oil and the fossil fuels and minerals plays a major part in this. What we would like to do in the next, and this, it can be done with the data that we have, is to break this down into both renewables and non-renewables to sort of see how that has had an impact. And then the last slide just adds into the black things, the lines that you see within those boxes is the inclusive wealth, the change in inclusive wealth in those countries. So you can sort of see that China's got one of the largest changes in inclusive wealth, which is not surprising based on their build-up of produced capital and human capital. And surprisingly not, or maybe not so surprisingly, the drawdown in natural capital. So one can always look at their trade, and basically that's coming from the fact that most of their natural capital is being met by imports from other countries. Now I want to switch my attention now to the topic that we are discussing today is the health. Now, we did not include health in the main computations, but we did have a session on health. And if you look at that breakdown, if you look at the difference in the size size of those figures, these are all in millions of US dollars. So that's you're talking trillions. Now, the IWI that you see right at the top is the sum of and this is absolute, this is not the changes. Just wanted to give you a rough idea of what these numbers are. And this is at the final year, which was in our case 2008. So in 2008, if you take a snapshot, for Germany, you would sort of see a 19 trillion worth of, that's the capital, that's the productive base of that economy, just based on produced human capital, which is education in this case, and natural capital. But if you look at the health, you've got a 411 trillion, a whopping 411 trillion dollars now. So the reason we took out health was because it basically just it dominates the whole analysis, and so we thought that we were not sure whether the way the computation of health was right, and whether we needed a little bit more focus in the future in the methodology and the theoretical basis of the health. So that's why we kind of kept health out of the computation of the IWI. And the same for Ecuador. So you sort of see a magnitude of 20, ranging from 20 to 30 and it is large. Now, there has been a discussion of this in some recent journal articles in the Journal of Development Economics, and the jury is still out, but the initial response is that maybe this is the number, and we shouldn't be too surprised because we are talking about health, and this is something that is of high value to people. Now, this is just a time trend. The next slide that I'm showing, this is just the time trend of the 4 types of capital. But if you look at the change in health, it's been very, very little, basically constant. So although the absolute amounts are very high, the actual change over time has been very, very low, and that might allude to one of the reasons that might be so, but in a later slide. And this is for Ecuador. Same trend that we see in terms of the health component. So the human capital, as I said, is education, and in health, we basically the only thing that is taken into consideration in health is the longevity, the reduction of the function of an individual's longevity in terms of the marginal value of just living an extra year. And the way that the shadow value for that was based on the value of the statistical life. So the key question here is that the right shadow value that we should be using in terms of estimating this particular component? Now, saying that, although as Kevin had alluded, there are 3 basic components in health. One is just the utility of just being healthy. The second is the productive nature of being healthy, so more of in terms of the return to productivity. And the third, which is measured here, is the value of living an extra year. And so even with those huge numbers, we are actually, this is an undervaluation of value of health, because we got the other 2 components that we still haven't added to it. So these are some of the theoretical, empirical questions that we have that we are now starting to put together a group to start teasing out some of those dynamics behind that calculations. So in 2012, the focus is on human capital. The 2014. The 2012 was on natural capital. The 2014, the main focus is on human capital, and we're going to look at the 2 components, which is on education, which needs also a little bit of more work, and health, of course. And the last slide, because I know I'm coming up to my time, I haven't heard any coughs there, but I'm expecting to hear that very soon. So the key challenges for health, the first thing is it outweighs all other forms of capital by a factor of 20, so we need to think about it. Is the value of statistical life the right approach for estimating using as a shadow price or the social price? And here we're only capturing one element of health, and we have some. But the one that I really want to focus here, and I think might be useful for a discussion, is the interdependency among capitals and health. So example would be pollution, the impact of pollution on health. That has not been captured, although theoretically within the framework it should be captured through the social price, but in reality that's extremely difficult, so one has to do computations of how the impact of pollution on health and to subtract that directly from the estimate of that productive base. So these are some of the challenges that we are facing for 2012, and we're just starting to putting together a team to sort of tease out some of these complexities. So with that, thank you very much. Gone about my 15 minutes, but I hope this was useful in the discussions to follow.
Thank you, Dr. Iapa. That is very helpful. And again, special kudos for doing that at 2 in the morning your time. That was a wonderfully coherent presentation, considering the time that you're doing it. And a lot of information. It will be an interesting discussion to talk about how do we move from these different elements, these different challenges to pieces that could be implemented in the current discussions on SDGs and MDGs, and how do we actually put some of this into operation. So I'd like to now introduce our next speaker, Dr. Richard Easterlin. He is University Professor and Professor of Economics at the University of Southern California. Dr. Easterlin is a member of the National Academy of Sciences and the American Academy of Arts and Sciences, a distinguished Fellow of the American Economic Association, Fellow of the Econometric Society, a former Guggenheim Fellow, and past President of the Population Association of America, the Economic History Association, and the Western Economic Association International. We're very pleased to have you with us this afternoon and look forward to your presentation.
Thanks very much. It's a pleasure to participate in this interesting program. My interest is to go beyond not only GDP, but also economic measures of largely of the sort that have been discussed, and to talk about subjective well-being, which includes the measure of happiness that was mentioned before, and also to talk somewhat about what some of the policy implications are of using this more comprehensive measure of well-being. My problem right now is I'm not getting any of the slides showing up here. So
again, I think we have a little bit of a delay of throughput with the internet to California and Malaysia, but some people will be seeing them. So if there's a way for you to see the slides you need,
yes, I have a printout here of the slides. So I'll work from that. I can tell what slide people are looking at. The current one being, what is SWB, or what is subjective well-being? So the answer is, it's the responses in a nationally representative survey to questions about how you would rate your happiness, or your satisfaction with life, or your standing on a best-worst life scale. If we want examples of the SWB measures, the happiness is evaluated in the United States by the question taken all together. How would you say things are these days? Are you very happy, pretty happy, or not too happy? Life satisfaction from the World Values Survey. All things considered, how satisfied are you with your life as a whole these days? The people answer that on a scale of 1 to 10. The issue that's repeatedly raised is whether these measures of happiness, life satisfaction, subjective well-being are meaningful. Well, we can appeal to authority. I have a quotation for you from the report by the Sarkozy Commission that was set up back in 2008, comprising about 25 economists, raised on the idea that you never pay any attention to what people say. But in that report, they come around to the view that, as shown in the quotation there, research has shown that it is possible to collect meaningful and reliable data on subjective as well as objective well-being. And several countries have taken official actions in this direction. The OECD and UN are promoting the collection and publication of these subjective well-being measures. For me, the more crucial indication of the meaningfulness of the data is what people say when they're asked about what makes them happy. And you find that the responses of people everywhere to what makes them happy are quite similar. You have before you a table that is showing the mention in an open-ended question, people's concerns with regard to factors affecting their happiness. As you can see, the three big things are people's living level, their family, and their health. After that, character and work. And broad social matters like social equity, international relations, domestic politics, all of those things in every country do not matter very much to people's feelings of personal happiness. It's actually the things that take up most people's time. They have to work, they have to raise money, they have to take care of their family, they have to take care of health issues. These are the matters that dominate people's responses on subjective well-being and how happy they are. The question is, well, are these measures of subjective well-being better than those currently being used, such as GDP per capita or the Human Development Index? One answer is yes. These measures focus directly on people's personal feelings about their lives. We're not relying on indicators that others have constructed, social scientists, statisticians, and so on, such as GDP or length of life or education, which are in the HDI. Another reason for thinking SWB are better measures is that they're more comprehensive. They're not confined just to people's particular living levels. They include their family feelings, they include their health concerns, their satisfaction with work, a wide range of matters that are fundamental to people's well-being that are omitted from the usual measures. And third, measures of happiness are measures people can identify with. If you say happiness is going up in a country, people can understand that. If you say GDP is going up or the Human Development Index is going up, well, whether they understand that or not is, I think, problematic. This is not to say that subjective well-being is the best measure of well-being. One problem is it doesn't reflect really, to any great extent, things like political and civil rights. But the argument for these measures, the subjective well-being measures, is they're better than the alternatives that we currently have. Let me turn to policy and talk about some policy implications of these measures. One measure is whether economic growth is a policy measure that will increase subjective well-being. The answer is no. The evidence is that over the long term, rapid economic growth has no effect on subjective well-being, although there is a positive short-term relationship between growth and subjective well-being. This is illustrated in slide before you. Yes. In this slide, you see the solid line showing fluctuations between GDP and subjective well-being that are synchronous. So that's showing the short-term relation, but the trend in the case of GDP is upward. In the case of subjective well-being is not upward. And so this illustrates the long-term absence of relationship between the two and the short-term positive relationship between the two. The evidence for this nil long-term relationship is, well, when we look at countries that have higher rates of economic growth, we do not see more rapid growth in subjective well-being. So if we look at the slide before you, what one expects is if economic growth really raises people's subjective well-being, that on the horizontal axis we have the rate of economic growth, the change in GDP per capita. On the vertical axis, the growth of subjective well-being, and we expect them to be positively related. The actual relationship that we find is shown in the right-hand panel, where America. The growth rate is on the horizontal axis. The vertical axis shows the change, in this case, in financial satisfaction, which is more comparable over time, but one would expect more immediately related to GDP per capita. And as you can see, a line fitted the data for 17 countries covering the period 1994 to 2006 is horizontal, no significant slope in the line, different than the expected positive relationship. There is evidence like that for Latin America. If we look at the data for 17 developed countries, for 11 transition countries, for 9 less developed countries, the period of time covered for each is shown in the parentheses. And finally, China, which has had the highest growth rate of any country in the world over the period since 1990 to 2012, income per capita in real terms has quadrupled there, fails to show any improvement in life satisfaction. I'll show you the picture for China shortly. So the policy conclusion is, does economic growth lead to greater subjective well-being? And the answer is, for a variety of countries, developed, transition, and less developed, there is no evidence that more rapid economic growth over the long run leads to a greater improvement in subjective well-being. So that brings us to the final issue. Are there other policies that will increase people's well-being, their subjective well-being? And the answer is yes, there is evidence that full employment and safety net policies increase subjective well-being. The evidence is of 2 types. First, a comparison of European countries with the same GDP per capita. We find that SWB, subjective well-being, is higher in countries with more generous supportive social policies. And the second piece of evidence is the negative impact on subjective well-being in transition countries where, in the movement from socialism to capitalism, employment and safety net policies are abandoned. Let me give you the European evidence first. Here we're comparing European welfare states with similar economic conditions but different public policies. So I've averaged 3 countries, Denmark, Sweden, and Finland, and I've averaged semi-welfare states, data for France, UK, Germany, and Austria, all of which seem quite similar. If we look at the macroeconomic conditions in these countries, we find that GDP per capita is virtually the same in the 2 groups of countries. The inflation rates are, in fact, identical, and the unemployment rates are virtually the same. So we are looking at 2 groups of countries where economic conditions are quite similar. What about their policies? Here I'm using a measure put together by a political scientist, the velocity of public policies with regard to unemployment, sickness, and pensions. The author, Lyle Scruggs at the University of Connecticut, bases this on work done by Espen Andersen, a Danish political scientist. You can see that in terms of the welfare states, unemployment benefits are more generous than the semi-welfare states. Sickness, the same is true. Pensions, the same is true. And overall, the 3 put together show greater generosity in the welfare state. So we have a situation where the economic conditions are identical, but the public policies differ between the welfare and semi-welfare states, with the welfare states being more generous. That well, does this show up in people's feelings of satisfaction? So we have here the responses to the following question. Tell me on a scale of 1 to 10 how satisfied you are with each of the following, where 1 means very dissatisfied and 10 means very satisfied. In terms of work, the welfare state population is more happy, are happier in terms of health. The welfare state people are happier in terms of family life. They're more satisfied with their lives, and overall life satisfaction is greater in the welfare state.
Dr. Richelin, I need to give you about a 2-minute warning.
All right. And the conclusion is the welfare states and the semi-welfare states have similar economic conditions, but subjective well-being is higher in the welfare state. The transition countries, what you see is unemployment rates going from around 0 upwards to 2-digit levels and then coming back slightly. If we look at their life satisfaction, you see the mirror image of that decline and then increase in China, in the Russian Federation, and the former GDR. The conclusion is based on evidence for the European states, based on evidence for the transition countries, full employment and safety net policy can increase happiness. As a final illustration, let me refer to Costa Rica, whose life satisfaction is highest in the world according to a Gallup World Poll survey of 130 countries. Their policies are indicated in this quotation from James Riley, a historian. The best known elements in Costa Rica's social development were introduced in the 1940s in the form of social insurance and pensions and the formation of a benefactor, welfare benefactor state. Earlier on, back in the 1890s, schools and general population literacy, healthcare facilities in a population armed with information to help protect them from health risks. So here you have a country in which early on, a century or more ago, they embarked on public policies that were very socially oriented. If we look at their GDP per capita, Costa Rica has 1/4 of the United States GDP per capita, but the world's highest life satisfaction, an indication of the overall importance of public policy. In summary, measures of subjective well-being are better indicators of well-being than those that are currently being used. Economic growth in itself does not increase subjective well-being, but employment and social safety policies do increase subjective well-being. And thanks very much.
Dr. Richelin, thank you very much for that provocative and interesting presentation. The dissociation between economic growth and subjective well-being is a very interesting point, and I'm sure we'll want to come back to that. Let me now introduce our final speaker for the webinar, and that is David Simpson. Dr. Simpson is Director of Ecosystem Economic Studies in the National Center for Environmental Economics at the United States Environmental Protection Agency. His other positions have included Senior Fellow at Resources for the Future, Associate Professor at Johns Hopkins University School of Advanced International Studies, and Visiting Professor at the University College London. His work is focused on the non-market valuation of biological resources, and he has published a number of papers on these and on other topics. Dr. Simpson is consulted in the development of the United Nations System of Economic Environmental Accounts, or SEEA, and serves on the Policy and Technical Experts Committee advising the World Bank's Wealth Accounting for the Value of Ecosystem Services, or WAVES program. Dr. Simpson received his bachelor's in economics from Whitman College and his doctoral degree in economics from MIT. So, Dr. Simpson, thank you for being with us today.
Thank you. Sound check, are you guys picking me up? No. How many economists does it take to? Okay, I have a friend who always says that the reason that meetings like this take so long is that even though everything has already been said, not everybody has already said it. So as the final speaker, it's a challenge for me to try to follow my prepared remarks without repeating too much that's gone on before. But let me start. Actually, I think economics jokes can be revealing. So let me start by telling a couple economics jokes. First concerns when Albert Einstein was coming across the Atlantic in the 1930s. Einstein was, of course, a Nobel Prize recipient world famous, but there was such a demand for transport that even he had to share a cabin with 3 other cabin mates as he came over on his ocean liner from Germany. And so, anticipating he was going to have a long trip, he came to the first cabin mate and he said, "Tell me, sir, what is your IQ?" And the first guy said, "My IQ is 170. And Einstein says, "That's wonderful. We can talk about the prospects for a unified field theory explaining all natural phenomena." Comes to the second cabin mate and says, "And sir, what is your IQ?" Second guy says, 140. Einstein says, "That's great. We can talk about the prospects for world peace with developments in nuclear technology." Comes to the third cabin mate and says, "And tell me, sir, what is your IQ?" And the third guy says, 70. Einstein scratches his head for a second, thinks about it, and says, "What's your projection for GDP?" So what does that mean? A lot of people think that GDP is just a matter of adding up prices and quantities, and in a sense it is. As the previous speakers have shown, though, it is more intellectually demanding than that, but that leads to the second joke. Second joke, I'm sure most people have already heard, concerns 3 people who go on a camping trip. They go on the camping trip, they find they have a can of beans, but they've brought nothing along to open it with. First person is a physicist, and she suggests they get a large rock and smash the can and open it by doing that. The economist says, "That's the stupidest thing I've ever heard. You're going to ruin the food when you do that." Second guy, what should the second guy be actually? Second guy's an engineer, let's say. And he says, "Let's build a fire and put the can of food on the fire, and then the pressure will build up inside and it'll explode." And the economist says, "You're just as stupid as the first suggestion. Can't explode, the food gets out, but it's all over every place and we're never going to be able to get it." So the other 2 are exasperated and they say to the economist, "Okay, you're so smart, what's your suggestion?" To which the economist says, "Assume a can opener." So let me now try to relate that to my topic here. As I said a moment ago, certainly there is a lot more than meets the eye to doing accurate national accounting, but a fair bit of it involves assuming can openers, and we have to be careful about that. Let me begin my slightly more formal remarks with a little bit of a quick whirlwind tour of some economic principles that are relevant here. Professor Easterlin just gave us a very interesting presentation on alternatives to the economic approach to the measurement of social well-being, but we economists are typically less imaginative. If you have the slides in front of you, this is John Stuart Mill, one of the great founders of economics, who basically said that what we want is what makes us happy and vice versa, and consequently, we economists begin with the supposition that our objective is to obtain the things we want, and we measure our success in achieving that objective by the amounts of the things which we presume that we want, since we've got them, that we end up with. So in a sense, there's a sort of circularity to that reasoning, but be that as it may, that's the way we proceed by supposing that people satisfy their objectives. The terminology we use for doing this, it talks about people's utility, and probably everybody at one time or another had an Econ 101 course. So just think back about what you had in Econ 101. We talk about people getting utility from the stuff they consume, and as I think it was Anantha said a moment ago, consumption can be defined very broadly. It doesn't mean destroying things in the process of consumption, but the things we enjoy. And typically accounting, even though we're adding up totals, what we're concerned with is change from year to year, or from one time period to another. So how do we think about how our well-being is measured by our utility changes from year to year? Well, our well-being is, again, measured by, or we assume it's measured by the things that we consume, the things that we enjoy. So we should be able to decompose changes in our well-being into amounts of stuff, changes in the amounts of stuff we enjoy from year to year. So a change in utility from year to year is the additional happiness in economics ease, the marginal utility we get from consuming one good, say apples, times the change in the number of apples we consume, plus marginal utility we get from bananas, times the change in the number of bananas out through zebras or whatever is at the other end of that string. If you remember this fact from Econ 101, the ratio of marginal utilities is equal to the ratio of prices. So from this simple relationship, we can say that our change in well-being from year to year is just the change in the amounts of stuff we consume from year to year each weighted by the price we pay for it. So the price we observe in the market, we typically assume is the value to us as consumers. So we compute we observe these quantities for marketed goods, multiply prices times quantity, add them up. That's our change in well-being from year to year. Now, the thing that's missing here, and as Kevin pointed out in the first talk, is we don't just want to just do this on a gross basis. We want to do this on a net basis. And as Kevin said, if we were just consuming but drawing down on our stocks of things that led us or made us capable of consuming more in the future, then we wouldn't really be getting better off. So how does capital fit in? Well, capital investment is the consumption we forego now in order to afford more consumption later. What's an investment worth? Here I'm going to wave my hands a bit, but to say in economic theory, we typically assume that investment is worth the value of the stuff we could have bought instead of putting the money aside to invest. Think about you as the head of a household. What's the opportunity to you of putting aside money in savings this year? It's the value of what you could have bought instead of savings. And then I have a little remark here that the brilliant Professor Marty Weitzman established in an article about 40 years ago now that, remarkably enough, the procedures followed in national accounting actually make sense in terms of how we would do it as a theoretical proposition of adding things up correctly. Gosh, I hope I've got the right slide. Okay, next issue concerns what about changes in quality? I've talked about changes in the quantity of things we consume, but we'll also be concerned with the changes of quality in the things we consume. And in the context of market goods, this arises with things like cars and computers. A car now is safer, more economical, et cetera, than the car in 1950. There's nothing remotely approaching a computer now was available in 1950, so we have to make qualitative adjustments there for things like cars and computers. But it's really a challenge to make these qualitative adjustments when we're talking about non-market goods. So the things we would really like to bring into the national accounts to give ourselves a better sense of how much better off we're really doing, as the previous speakers said, are things that aren't currently measured, like environmental quality, like at least the economic value associated with crime, like aspects of health. So it's really a challenge to bring these non-market goods in. And the challenge mostly revolves around the fact that a lot of these non-market goods are what are called public goods. A public good is something which, when one person provides it, it is provided in essentially similar quantities to everybody else. So if somebody provides environmental quality, everybody enjoys that environmental quality. If I buy a car that pollutes less, everybody benefits from my car having polluted less. And because we're not compensated for providing public goods, the prices of these public goods supplied in markets, the prices are not reflected in market prices of goods. And then I refer here to another economic fact that typically when economists talk about the value of public goods, they're valuing that year-to-year change in quality. What we talk about is a willingness to pay a sort of imputed price, or as Anatha said a couple of minutes ago, a shadow price of that quality. Now, there's also the issue of flows and stocks, and then I'm going to talk a little bit about anomalies. Whoa, that much? Okay. Okay. Let me really quickly then say that consumption is a flow. We're often interested in capital stocks. Some things like environmental effects are captured in flows. For example, the Deepwater Horizon disaster was reflected in flows of service such as reduced fisheries, but we'd also like to have a reflection of the reduction in natural capital, the stocks of fish that aren't there to be caught in the future. Point out in passing that the accounting often isn't complete and can be perverse. For example, the way the accounts are constructed now, if we don't account for environmental devastation, then GDP actually goes up if you are consuming health services because we get sick, but we should be offsetting by that by your willingness to pay to avoid getting sick. There's all sorts of things that are omitted from the environmental accounts, and I really should be chastised for this. I didn't put health, which is one of the most important of these. If you looked at the progress of the 20th century, arguably the single most important thing that occurred in the 20th century was the increase in global lifespan of about 25 years per person with antibiotics, and particularly improved public health and sanitation. Sewering of cities, I don't have to tell you guys this, but sewering of cities made a tremendous difference. A huge problem pointed out in passing, and this goes to Professor Easterlin's remarks, that there also should be equity concerns here. On the slide, I say, is society better off with Bill Gates getting a $400 million yacht, or Bill Gates providing $399 million in vaccines to poor children in Africa? The answer to that is obvious, but the usual way of dealing with that problem doesn't account for it. I'm going to skip over the last slide and go straight to my parting thoughts, since I've probably got about 10 seconds now. This is Oscar Wilde. Oscar Wilde famously said in one of his plays, "What is a cynic? A man who knows the price of everything and the value of nothing." We're not going to be able to get the price of everything into the national accounts. Interesting question as to how hard we should try to do that. A line that is less often quoted, though, and something we should also keep in mind, is the next line of the play, Lady Windermere's Fan, has another one of the characters saying, "And a sentimentalist is a man who sees an absurd value in everything and doesn't know the market price of any single thing." We are engaged collectively, we as economists are engaged in the very difficult undertaking of putting prices on things that are not traded in markets, and for that reason, I guess I'll conclude my remarks by saying that while it's a noble undertaking to try to bring all these values into national accounts, we should be taking the estimates with a couple of grains of salt and recognizing that techniques for doing so will improve over time. Thank you.
Great. Thank you very much. Sorry to ever cut anybody short, because those were wonderful thoughts and a nice summation of the topics that we've had. And again, I'm struck that moving from the conceptual to the operational is going to be a very interesting challenge and discussion. So let me encourage everybody who is listening in to send in questions. I have several here to start with, and I'll start reading them, but please do feel free to send them in through our website. The first question is for Professor Easterlin, and it says, how does the notion of trade-offs okay, this may be a little. How does the notion of trade-offs across the different constituents that make up subjective well-being? I'm sorry. Let me make sure I can get this grammar right. So it's alluding to the different constituents that make up suggestive well-being, and it asks, how do the trade-offs among them get reflected or captured for policy making, for the allocation of resources, etc.? That is the question. I'm not sure I completely understand it, Dr. Easterlin. Do you understand that question?
I think so. I think the issue is, well, if people's happiness is dependent on their income, on their jobs, on their health, on their family, and we have to make choices in public policy as well as personal choices among these alternatives. How do we do that? That is, to what extent is one more important than the other? My answer to that is, I think it's pretty clear if we look at the experience of China, where incomes went up fourfold, but no impact on life satisfaction over the past 20 years, that just raising incomes is not the way to go. On the other hand, employment is central to people's lives. They need to have jobs. They need to be assured of those jobs. And if they don't have jobs, they can't support a family. They can't take care of health problems, and so on. So the big issue is, I think, a focus on employment considerations, and secondarily to that, policies with regard to family and health. As far as raising income in itself is concerned, I mean, if we go to China's case in 1990, the income levels absolutely in urban areas were quite low by any standard that we know. But the people were pretty happy because they were assured of family support capitalism is the answer to the problem, but it's pretty clear, if you look at the Scandinavian countries, that welfare states that take care of these types of concerns for people fare quite well with regard to overall well-being. So I think the answer is not economic growth in itself, but policies that deal with the concerns that are fundamental to people's lives. Thanks. I think that's as far as I can.
Dr. Easterlin, we're losing you. I'm not sure if you stopped speaking, but you were fading out at the end.
I stopped speaking. That's the end of my answer.
Okay. Thank you very much. The next question gets at, I think, the last presentation as well as, to some degree, all of the presentations, and it is asking how can the externalities, how can the true cost of goods, and by true cost this means kind of a life cycle look at the cost of production, extraction, waste handling, the typical life cycle consideration of costs of a good. And the question is, how can that true cost be incorporated into indicators like the GDP or the SWB for that matter? And I guess there was talk about adjusting the GDP. Maybe that's one part of the answer to that, but maybe the speakers can address that question. And Dr. Simpson, did you want to start with that?
Sure. There's a variety of ways that economists go about trying to put values on non-market goods, but maybe one of the most revealing things we could note here is one, as I said, and I think Kevin alluded to earlier, one of the most important things that's happened in recent decades, last century certainly, is the great increase in longevity. And how would you go about putting a value on the increase in longevity? Well, people go about doing that with a technique which is badly misnamed the value of a statistical life, which is inferred from the risks people are typically inferred from the risks people are willing to take to, for example, take dangerous occupations or live in dangerous places. But I think you can get some idea of the controversy involved in the statement that U.S. government agencies typically put a value of about $6 or $8 million on the value of a statistical life, the value of the probability that somebody is going to die early. And as you can imagine, it's not at all a precise estimate as to whether a premature death is worth that much money, and would be a tremendous amount of controversy as to that sort of valuation. And that's just one example among many where it's very difficult to come up with these estimates.
Thank you. Can we turn it over to the other speakers? And I'm recalling there was a slide, it may have been from Dr. Ananth's graph of the different countries and the disconnect between the extraction of the resources versus the increase in the wealth produced from those resources. And so the question is, how can that cost that's being shown in that, of depletion of long-term resources, how does that cost get reflected back into an index like a GDP or another indicator of economic growth that is derived from those negative impacts, if you will? And that's open to all of the speakers.
I could respond if the CONT is not available for that.
Sure, go ahead.
Okay. Well, so the first point I think is just I think it's a bit of a I think it's a bit of confusion to try to adjust GDP to incorporate various externalities and so on. I mean, GDP is simply the measure of income. It's national income, and then to take that measure and say, well, we won't really count part of the income as much because producing it caused some cost on society and so on. I'm not sure that this is the right way to be going about this. I mean, I would think that what's happening is you have this flow, this income flow, and then you have these other things that are depletions of capital stock. So if the cost that we're thinking about here is a cost like we're going to be harming some wetland, for example. I mean, that's not exactly an income flow. What we're doing is we're hurting some stock of capital we have. The capital is the wetland, and we are making that wetland less valuable because it's going to provide fewer future services for us. And so, these measures like green GDP or some sort of adjusted GDP, while they can be useful measures for visualizing certain things, I don't know if this is the direction we should be putting all of our effort into. It seems like these costs are quite easy to use. These kinds of externality things are very easy when you incorporate them into a wealth measure. And so that's what I propose you do.
Thank you, Dr. Mumford. I was just going to say that seemed to be one of the points of your talk, and also of Dr. Dairapa, which was that GDP is by nature limited, and that alternative measures like a wealth measure, which would reflect, the reserves and reflect the capital, would be the better measure. So let me ask a question then on the back of that, which is, if the GDP is limited and if the wealth measure does a better job of capturing these kinds of things, why is everybody, or what are the prospects for more reliance on a wealth measure in these kinds of international settings in conjunction with the GDP or in distinction to a GDP? The supposition is that these are better reflections of the actual wealth well-being of a society. Are these being included now? Are they becoming more prominent? Is there opposition to them? What are the prospects for actually using these kinds of alternative metrics?
I think the answer is definitely that there is a lot of interest in including these measures, and progress is being made along several fronts. I think it may come back, though, to the old cliche about whether it's better to be approximately right or exactly wrong. And I think we can all agree that the GDP as currently constituted is exactly wrong, because we can say with certainty a number of things are excluded from it. It's harder to figure out how approximately right we are, though, in making the required corrections. And to just continue Kevin's example, what we should do if a wetland has been destroyed, as an example, would be to regard that as a depletion of a form of capital. But then in order to value that form of capital, we'd have to quantify the wetland services. What are they? They might be waterfowl nesting habitat. They might be water purification. They might be flood protection. Now we've got three very difficult non-market valuation exercises to go through. Once we're done doing that, we can have an argument as to what the appropriate discount rate is in order to compute those or to convert those values or yearly values into net present value of the lost asset. So yes, it's the right thing to do, certainly, to incorporate those into the accounts, but it's a very difficult process and will involve assuming many can openers.
Thank you. Dr. Mumford or Dr. Eastman, did you want to add to that?
Can I just add a couple of things to that? Is that one possible way to go forward, because there is a high degree of uncertainty, especially both in terms of the physical stocks that we have, as well as the whole notion of the shadow pricing. One possible way is not to come with point estimates, but to come up with bands in terms of an upper and a lower band in terms based on the best information that we have, and sort of say that this is the band between the upper and the lower limit of how our stocks have changed over time. So that's one possibility, and so that policymakers have a clue of that how broad that band is or how narrow that band is, and it also provides some guidance on where more work needs to be done. And I think that's an important information by itself.
Thank you very much, Dr. Duriappa, and that gets at this idea of the approximately right, and by providing bands of uncertainty, and then there has to be a balance of how much uncertainty do you want to provide to the policymakers, and that's always a question in economics and environmental health, et cetera. How do you convey that uncertainty, and how do you deal with aggregation of uncertainty? Dr. Munford, did you have a comment on this? Okay. I have a comment that's been provided to us from the Secretary of Health from Mexico, who says that from this presentation we can understand how the cost of education and health can generate well-being and happiness in the same way that they can be included in the budget and addressed in public policy within a health and all policies framework. So thank you very much for that comment. Do we have other questions? We had a couple of other questions that had come in. One question I'll try to interpret. It had to do with the opinion of the presenters. Based on the discussion that we had and some of the evidence that was shown, especially in Dr. Easterlin's talk and Dr. Duriappa's talk about the effects on well-being indices and on subjective well-being of social policies and the welfare state and supplements of income and safety nets, et cetera. I think it's in that context this question comes in. It says, what is the opinion of the presenters about an unconditional citizen income for all citizens, and what the effects of that unconditional citizen income would be for personal and social well-being?
I guess I'll take a crack at that. I think it goes to a long-standing and unresolvable controversy referred to as a trade-off between equity and efficiency. It would be nice, certainly, if the least advantaged members of society were assured of a minimal level of well-being. The problem with that is we affect incentives by doing that. And I guess I will confess that I'm spouting a pretty typical economist line here, but if we don't allow for some prospects of inequality, then we reduce the incentives for creation of wealth. I guess my personal opinion would be that we've probably gone too far in the U.S., at least, in the direction of tolerating inequality, but I wouldn't want to see us swing back to the other extreme either.
Thank you very much. Do any other speakers have a comment on that question?
I had a quick comment on what you had asked earlier, if that's okay.
Sure, please.
Earlier when you'd asked for comment, for some reason my talk, but I was muted. But earlier you just asked what are the prospects for doing wealth accounting, national wealth accounting, and if it's really so great, why is everybody so focused on GDP? And so we discussed this idea that GDP, the methodology is much more solid. We're more, we're more exact or more precise in our measurement of income than we'll ever be with wealth, and that's true. But I think it's important to point out that measuring wealth alone is not sufficient, right? So it's not as if doing this wealth accounting will mean that we no longer measure GDP. I mean, they're answers to different questions. There's lots of reasons why you'd want to know what GDP is that are separate from wanting to know what national wealth is. And so we'll always be using both, I would hope. And as for the question of why countries haven't been adopting this wealth accounting is one that there are these questions of methodology. Two, the data hasn't been demanded by academics, and it's only recently that there's been this strong demand for using this framework to try to evaluate sustainability. And there is some interest. I mean, the UN's Inclusive Wealth Report, the World Bank's efforts at doing their net savings measures, and there's been some interest by other countries' governments in pursuing this as something that their statistical office will undergo, doing some preliminary wealth estimates. So I think this is gaining traction and is likely the direction that the the international community is going to adopt for answering questions of sustainability, at least in terms of the kinds of things that national statistical offices will be doing. All right, thanks. That's what I wanted to add to that.
Excellent. Thank you very much. And Dr. Mumford, that will give you the last word. Appreciate that addendum. I want to thank all of our speakers. I'm sorry, another speaker has a comment?
Very quickly, just in terms of that unconditional citizen income, I would sort of rephrase it in terms of drawing on Amartya Sen's work on instrumental freedoms and sort of look into that space as an unconditional access to those forms of freedom, rather than just looking at it from a very restricted income base. So making a distinction between the difference between opportunities, access to opportunities versus endowments. And I think there's been a trend towards endowments rather than towards opportunities, but making sure that there's a framework for those opportunities, and Sen's framework provides one such avenue.
Okay, thank you very much for that additional comment. With that, we've come to the end of our hour and a half. Again, I want to thank all four of our speakers for excellent presentations and excellent discussion after those presentations. We've just started, I think, scratching the surface on this topic, and it will be one that will be very interesting to see how it plays out in the discussions going on around the Millennium Development Goals post-2015 and the Sustainable Development Goals. I want to remind everybody our next webinar will be in about 4 weeks, June 27th, at the same time, 2:30 to 4. I hope you'll all join us then. And with that, we'll close. Thank you all very much.